Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Good afternoon, everyone. It's Susan Coffin here from Attitude Magazine. I'm pleased to welcome you today to this week's Attitude webinar. We have a wonderful guest today, Dr. Sandy Newmark, who is the founder of the Center for Pediatric and Integrative Medicine in San Francisco, and the author of a very well-regarded book, ADHD Without Drugs, A Guide to Natural Care of Children with ADHD. Dr. Newmark will be speaking today and taking questions on the subject of alternative therapies for attention deficit. Although he is a pediatrician and he's primarily works with children, he's comfortable responding to questions from those of you who are adults about the topic of alternative therapies for ADHD. Dr. Newmark has a Facebook page I want to direct you all to, ADHD Without Drugs, and he is the head of the Pediatric Integrative Neurodevelopment Clinic at the University of California, San Francisco. He's a regular columnist to Attitude. We're happy to have his input. And with that, let me turn it over to Dr. Newmark.
Hello. Thank you all for listening. How I wanted to start is to say that I am an integrative doctor, and by that means that one of the primary things is I integrate both conventional and alternative treatment. And so we should look at alternative treatments for ADHD as part of an integrated treatment program, and that could include behavioral interventions, school placement, classroom management, and medication when appropriate. So it's not just, oh, we're going to use alternative treatments or we're going to use regular treatments. So I integrate all of it. One of the things about alternative treatments is sometimes on their own they are equally effective as medication, and I will talk about some of the research showing that and my own clinical experience. But they can also be an important part of the treatment program for children who are taking ADHD medication. Again, it's not an either or. One of the things about alternative treatments that's important is I think they can lower the necessary dose for kids who do need to be on medications. And that can make a big difference because the side effects are often related to dose. So if you can lower, by using whatever alternative treatments, the necessary dose, that would be good. So my major focus is nutrition. I think that's the keystone of any alternative treatment program. No matter what else I do, nutritional intervention is extremely important. The first part of it is a healthy diet without artificial colors, flavors, preservatives. The diet should emphasize a balance of unprocessed, low glycemic index, carbohydrates, protein, and healthy fats. So by that I mean when a child eats a breakfast, say, of a Pop-Tart, which is essentially sugar wrapped in sugar, the blood sugar goes up very quickly because it's absorbed so quickly, and then the body produces insulin and other hormones, which drop that sugar very quickly and actually drop it below normal levels. And then you have a child a couple of hours later who might be hypoglycemic, irritable, not paying attention, and this can certainly exacerbate ADHD symptoms or even look like ADHD in a child who might not have it. On the other hand, a child who might eat some oatmeal or an egg with toast and a glass of milk, the blood sugar won't go up like that. It'll go up slowly and you won't have that whole process. Also, fruits and vegetables are very important for their antioxidant and vitamin content. The other part of nutrition is that many children with ADHD are sensitive or even allergic to certain foods. And when these foods are removed from the diet, symptoms improve, sometimes really dramatically. There have been a number of research studies that have shown this. In fact, they've been doing these studies since the 80s, and there's at least 5 or 6 of them that I know of. And each time kids in these studies are placed on a strict elimination diet, many of the children have dramatic improvements in their ADHD. And I see this in my patients on a regular basis. Unfortunately, there's no test that will show if ADHD kids are sensitive to these foods. And the only way to do it is through an elimination diet, which maybe we can talk about a little more later. The important thing about the elimination diet, this is eliminating sort of the most common foods. It could be gluten, it could be dairy, it could be corn or soy. So it's foods that are not unhealthy in themselves, except in those children who are sensitive to them. The other, when we start getting into supplements, the most important one I use are omega-3 fatty acids, fish oil, and I think those are a very important part of any integrated treatment program. Multiple research studies have shown them to be effective, and for the most part without side effects. They can be taken as capsules or in liquid form. One big hint is that the little gummies or chewables that a lot of people tend to use because they taste good and they go down easy, they have very small amounts compared to what we need to treat ADHD. So you need to take 16 or 20 of those a day to get an adequate dose, which is not very practical and very expensive. Two other minerals that are really important are iron or zinc. Research has shown that those can affect ADHD symptoms. In other words, deficiencies of either of those can worsen symptoms. For that, you need to check levels, especially with iron. It's probably okay to give some zinc without checking levels, but iron should always be checked because having too much of it is dangerous. But if that's something that I check in all the kids I see with ADHD, and they are actually abnormal a very significant percentage of the time. So that's a very simple test that can be done with a blood test and should be done. I noticed that in the pre-questions there's a great deal of interest in computer-based treatment for ADHD. And we can talk about this more, and I'm sure we will, but the two that have a reasonable body of research to indicate that their effectiveness are EEG Neurofeedback and Cogmed. So I'm sure we'll be talking about those. Other home computer programs might be helpful. We just don't have the kind of research that supports it yet. And there's just a lot of stuff coming out there that may or may not be of any use at all. So I think that's just my little short 5-minute talk, and so let's get right to the questions.
Okay, sounds good. First question here relates to an herb called rhodiola, or a supplement, I guess. The question is from Gary, and he asks, what experience do you have with rhodiola for ADHD adults?
My answer is that rhodiola is what's called an adaptogen, which means that it sort of generally makes the whole body kind of function at a sort of higher level. It is never been researched for ADHD at all, although it's part of some combination products for ADHD. And I don't have any experience of adults who've used it successfully for ADHD, but it's possible that it's helpful as part of a program. Seems to be a safe herb.
It's a safe herb, okay. So Gary will let us know if he tries it, if it works.
Right.
There's a question from Jane who wants to know, is it safe to use alternative therapies and products while on prescription medications?
Absolutely.
For a child, yes.
Yes, the answer is, in general, absolutely. There's at least any of the alternative things I'm going to mention or that are in my book are completely safe to use with ADHD medication. Now, there may be some stuff out there that I don't know about it, so I wouldn't want to give a 100% universal thing, but omega-3 fatty acids, diet nutrition, elimination diets, iron, zinc, valerian, those kind of things are safe with ADHD medication.
That's great. Here's a person Warren, who has a 6-year-old, and she gives her son a fish oil supplement with a high ratio of EPA to DHA, and she wants to know what the maximum safe dosage is for a 50-pound 6-year-old.
Yeah, that's a really interesting question, and the answer is we don't know the maximum safe dosage. I'll tell you that I use, for a 6-year-old, I would probably go up to 1,500 milligrams in general of total EPA plus DHA. That's how I dose it. Mm-hmm. The amount of total EPA plus DHA, you add those two, and the maximum I usually use in a 6-year-old is about 1,500 milligrams. But there was one study where they gave young children between, I think it was 7 and 10, about 16,000 milligrams of omega-3s.
Oof.
And amazing, yeah. I can't believe they actually got a review board to approve it. But actually, it was a small study, but out of, I don't know, 10 or 15 kids, one child got diarrhea and everybody else was fine. And the child who got diarrhea, it went away when he went down to a smaller dose of like 7,000 milligrams. So we don't really know so much what the maximum dose might be, but that's mine for about a 6-year-old. And a bigger kid, say a 12-year-old, I might go to between 2,000 and 3,000 milligrams. So that's sort of mine. Another thing is, I'm glad you mentioned the EPA to DHA ratio. So for those who don't know, the two most important omega-3s in our body are EPA and DHA. And the reason those are so important is we can't make them ourselves without omega-3 substrate, or without taking some kind of omega-3 into our body. But we can convert linolenic acid, which comes in flax oil, to omega-3s. But we have a limited ability to convert it. So anyway, there's a lot of interest in, well, what should be the ratio? And this person mentioned high ratio of EPA to DHA. Well, most of the studies have been most effective when there's a more EPA to DHA, but not what I would call a high ratio. Usually it's maybe twice as much EPA as DHA, 1.5 times as much. I've heard people talking about a 7-to-1 ratio, and I don't know where that comes from, because none of the studies I've seen on omega-3 fatty acids use that kind of ratio. So my recommendation is more EPA than DHA, but not that very high ratio.
Sort of 2-to-1 or so, or?
Yeah, 2-to-1 is fine. And I should mention here, a lot of people wonder about the evidence. Well, omega-3s are one of the things for which there's been the most research on ADHD. There's really been a lot of studies. And most of them do show that it's effective, although a few didn't show an effect. But what somebody did was they did a meta-analysis of all the research a couple of years ago, which was published in one of the big journals. A meta-analysis is where you take all the research studies and crunch the statistics together, so you're working with a way bigger number. And that study, that meta-analysis, showed that omega-3 fatty acids are what they said was moderately effective for ADHD on their own. So moderately effective, they defined it as about 40% the power of medication. In other words, there's all those studies compared to all the studies of meds showed it was about 40% as effective. They said, oh, well, it's only 40% effective. Well, to me, that's huge. I mean, to take a supplement that's good for you in a number of ways, that has almost no side effects, and have it be just on its own that effective, I think is terrific. And so to me, that means that, I use everybody who I see takes fish oil. It's a sort of no-brainer.
Well, we have a flurry of questions just around the question of dose, so maybe we can just recap that. The sort of dose for children, for preteens, for teens, for adults, sort of, is it by weight? I mean, people are sort of wondering how they know.
Right. So again, there is no definitive information on dosage. I mean, it varies in the studies, it varies in what people use, but I think a safe dose would be, say, for a kid under, well, most kids aren't diagnosed with ADHD until age 5 or 6. So let's say for a kid, 5 to 8-ish, smaller child, like I said, 1,000 to 1,500 milligrams total EPA plus DHA. For a bigger kid, 2,000, 2,500 milligrams. And then there's really no good studies been done in adults, but you could, just sort of say, okay, maybe 3,000 milligrams.
Okay.
So somewhere in that ballpark. And the reason of being vague is nobody really knows. I can only tell you what I do and a lot of people I work with do, but the studies on what exact dose really is the best remain to be done.
Yeah, I think people are just happy to have a general sense of what they should try, and that's really helpful. People are wondering, is there a certain brand that you recommend? Are they all?
Well, yeah, I do. I have ones that I like. So the two brands that I like the most are Carlson and Nordic Naturals.
Okay.
And one of the things I like about both of them is they have products that have a lot of EPA and DHA per the amount of omega-3s you have to take. So they're highly concentrated in EPA and DHA. There's lots of other good products out there. These are also those two are also not ridiculously expensive, and they come in capsules and liquids. Nordic Naturals has an advantage. They have a half-size capsule for those kids who won't take the liquid, can maybe swallow a small capsule, but not that, omega-3 normal capsules are pretty big.
Mm-hmm.
They're soft, but they're pretty large.
Yeah.
To them. So they have kind of a half-size one. That's a nice thing. So those are the two ones I like the best.
Okay.
I don't really, if you have to get them because of money from a Costco or something, I think that's okay. I don't trust them to be as good a product. I should mention that a lot of people worry about the mercury or the contamination in fish oils. The companies I recommend, most good companies, purify these things very intensely. So they have it's safer than eating fish.
Huh, interesting. Similarly, doses of zinc and iron. I guess you said earlier that those levels should be tested.
Right. So iron, I won't even say a dose because it really depends on the level, and I don't want to say a dose because I don't want anybody to take iron any more than you get in a multivitamin without consulting their doctor. Zinc's a little different. I like to check levels, but I think it's okay to say give between 20 and 30 milligrams of zinc a day if you don't want to check levels. Unlikely to be harmful.
Okay. Zinc. There are a couple of questions here from people who say that they have children who are extremely picky eaters, kids who eat only white food and so forth, and they're really wondering if you have any tips for getting them on healthier diets. They're struggling with that.
Yeah, well, that's obviously a really difficult thing, and I don't have just an easy solution at the tip of my tongue. I think it all has to do with how you manage and kids' behavior, and to me, rewards or positive reinforcement is always the best way to manage kids' behavior. I like, and maybe we can talk about this in another context too, but I think how you work with kids behaviorally is incredibly important in ADHD. I like an approach called the nurtured heart approach, which was developed by Howard Glasser and is in a book called Transforming the Difficult Child. And in this approach, there's a tremendous emphasis on positive feedback and reward, and even a point system, which I know some parents have tried, as well as clear discipline. So if you were using this system, you could actually incorporate that into encouraging new foods, because if kids get positive rewards for encouraging new foods, they're much more likely to do them. On the other hand, trying to force kids to eat or making things stressful doesn't work at all. It's just counterproductive. So, trying to, just argue with kids or punish them or just make mealtime a stressful, difficult time is really not the way you want to go. The other thing I would say, though, is you don't have to offer kids stuff that you don't want them to eat. There's a great quote from one of the famous feeding therapists in our country. It says, parents' job is to offer children the food they would like them to eat when they would like them to eat it. And the child's job is to decide what and how much to eat.
Yeah, exactly.
Okay? So if your kid is eating all, white food and wants junk food, don't offer it to him. Get it out of the house. Mm-hmm. Very, very few children are going to starve to death because you didn't offer them what they wanted. Right?
Yeah, really good suggestion. Yeah.
So, if your child is stuck on, macaroni and cheese and white bread, move towards not offering those foods and say, look, this is your choice now. If your child eats, like I said, Pop-Tarts, sort of my image for a really, really bad food. Like if your child is eating Pop-Tarts for breakfast, throw the Pop-Tarts out of the house. Don't buy them. Offer a choice of a few healthy things. And then if he or she doesn't like that, well, they don't have to eat breakfast. I guarantee it won't last very long. In most kids.
Yeah.
So that's my general approach. Positive reward system, only offering what you want them to eat, and those are the main things. And not making it a big stress thing. It's like, okay, this is what you can have. Which one did you like? Oh, you don't want any? Okay, sorry.
Great. Turning from nutrition for supplements for a second, number of questions on biofeedback. People are wondering about the difference between biofeedback and neurofeedback. Are they different? Are they the same? And saying, their impression is that it's difficult to find a practitioner. Do you have any thoughts on I guess in general, on a little more detail on neurofeedback and biofeedback?
Let's talk about neurofeedback because it's something that just fascinates me. EEG neurofeedback is simply a type of biofeedback. Biofeedback refers to anything where information from the body is fed back into the conscious mind. So it could be a little thing on your arm to measure blood pressure, or it could be something on your skin to measure skin resistance. In the case of EEG neurofeedback, it's some sensors on your brain to measure brain waves. So EEG neurofeedback is a type of biofeedback. It also is something that has been studied pretty extensively in ADHD. There have been a number of studies, many very scientifically valid and with good control groups, and the overall information from the studies is that it is effective for ADHD. There's, of course, people in the ADHD establishment who argue this, and that's their right, and it's not the easiest thing to study in terms of having good control groups because you can't just give a placebo pill. But there's been two big research evaluations in the last few years and in good journals, and one of them came to the conclusion that it was definitely effective for ADHD, and one of them said probably effective for ADHD. So that's pretty good for a therapy like this. So I think out of all the sort of computer-based therapies, that's the one that's got the best research. What happens with EEG neurofeedback, because I saw some questions about exactly what does happen, is that it's done by psychologists as a general rule, although a few other people can do it too. And you go into an office and they put just a few little sensors on the scalp, and then they hook those up to a video game type thing. And the child simply goes in and plays the video game, only it's set up so that if the child is not using their brain waves in the way we want, and I don't know how much people want to get into this, but most kids with ADHD don't have enough beta waves, concentrating waves, and too much theta waves, spacing out waves. So what it does is if the child is using their beta waves, they succeed in the video game or some variation of that. If they're not, they don't. And so they learn what it takes to use their beta waves. So, and if you do
sort of a habit, a training of habit sort of.
Yeah, sort of like that. I mean, it's just like any kind of, it just sort of teaches you unconsciously how to do this, and then you do it over and over again, and you form a good habit. That's right. So usually what they'll do in these studies is they'll give a kid about 40 sessions and measure ADHD behavior and brainwaves before and after. We don't know how long the effects stay positive. In other words, what happens 3 years later. We do know 6 months later one of the studies showed that it was still effective, but I think that remains to be seen. So what's the downside? I mean, this sounds like, wow, you can change your beta waves. You don't have to take a medication. It seems so intuitively good. The downside is two things, very expensive and time intensive. So you're looking at 40 sessions at somebody's office. Sometimes people do 30. Sometimes people do more. 45 minutes or so. You got to take the child there and bring them back. And usually you're talking somewhere in the neighborhood of $4,000. And unfortunately, insurance doesn't usually pay for it.
Wow.
So Yeah. See, that's the big hang-up, and that's why I don't have hundreds of people in my practice who've done EEG neurofeedback. I've had some, and I've had some really good reports, and some people who didn't benefit. It's always like that in any of these therapies. It's really a shame, because if you have insurance and you need to go to a therapist for 6 months, usually insurance covers that. But if you go to that same psychologist and get neurofeedback, it doesn't cover it, and the cost would be the same. But there it is.
Yeah.
So
probably another topic, but I wonder how this will change under the new healthcare laws.
I don't think it will.
Enough benefits to alternative. Yeah, no. Okay.
I don't think this will change.
Yeah.
I don't think it's addressed, unfortunately.
That's bad.
Can I talk about Cogmed now, too? Have you got...
Yeah, that would be a good idea, yeah.
As well, because it always is asked in the same thing.
Right.
So Cogmed is a little different. Cogmed is a treatment for working memory. Now, working memory is something that's often, although not always, a big problem in kids with ADHD. You would know that by doing psychoeducational testing. It's usually test working memory. Working memory is the kind of memory that when you're working on the second half of a reading problem, you remember what was in the first half. So it's keeping things in your mind long enough to use them, not like what happened last Saturday or 2 years ago. So Cogmed is a home-based computer program but you work with the Cogmed group, kind of online while you're doing it, but you do it at home for 5 weeks for 45 minutes. And it actually improves working memory. And the research on that is pretty good, too. And it seems like when you use it and improve working memory, it also improves ADHD symptoms. So that one costs more in the neighborhood of $1,500 rather than $4,000. So that's nice. And again, I've had some people who told me that Cogmed seemed really helpful, and other people told me it didn't.
Right. Okay. I mean, I think lots of people are interested in trying Cogmed, definitely for improving school working memory and for their children at school. Some other supplements that have come up. CoQ, question about CoQ and
CoQ10.
CoQ10 rather, and GABA, GABA. Do you think that that's helpful for calming? And for anxiety, is there anything that you would suggest for anxiety? Sure.
Oh yeah. So let's talk. CoQ10 is an antioxidant, and as far as I know, it has no particular role in ADHD.
Okay.
I don't see any reason it would be helpful for calming. I mean, it's a pretty safe supplement. It's okay to take for general health, but it really doesn't have anything to do with ADHD that I know about. For anxiety, there's a number of things you can use, and that's a good subject to bring up, because I think many kids who have two things. I think many kids who have ADHD do have a significant amount of anxiety, either because they're born with it, or that's how they tend to be, or because of what we've done to them. Because, these kids get so much negative feedback, and people are always yelling at them and telling them, don't do this and do that, and they have trouble at school, and it would make anybody anxious. Think about going to school which is hard for you. It's hard to sit, it's hard to pay attention, and you have to do this for 6 hours every day, and sometimes they get a lot of negative feedback. That's why I like that nurtured heart approach with the positive feedback. So I think a lot of kids who have anxiety can be misdiagnosed as having ADHD. So you're treating the wrong thing. So that's why it's so important to get a careful diagnosis of ADHD. It's so important not to just, talk to a pediatrician for 10 or 15 minutes and fill out a form and, okay, has ADHD. Because you can, things like anxiety, learning disabilities, depression, giftedness, these can all be misdiagnosed as ADHD or can go along with ADHD. So that's really important. So I'm glad it was brought up. For anxiety, there's a number of things that can be helpful. GABA, I don't use so much for kids with ADHD because it can actually make people more hyper, but it can work. I like something called inositol for anxiety, inositol. I talk about it.
Say that again.
inositol.
Okay.
And I'm not going to give dosing. It's in my book. It really varies as to weight, and I don't want people to just go out and get it themselves. But it's okay to ask if you can find a doctor who deals with this. Inositol is a good thing. And then very simple things like teaching relaxation breathing can be really helpful for anxiety. I teach some kids with anxiety self-hypnosis techniques, yoga, meditation. By the way, yoga and meditation I think are really good for ADHD themselves, even without.
I'm glad you brought that up because there was a question specifically about yoga. Yeah.
Yeah. So anyway, I think those are the kinds of things that you can use for anxiety.
Okay. Do you want to talk briefly about yoga?
Oh, yeah, sure.
Itself, sure.
So there's not really any significant research on yoga, but I think that it can be really helpful for the right kid. And I've had a number of parents who've told me that when they got their kid to do yoga, they were calmer. It just really helped them calm down. And, it makes sense. I mean, people have been using yoga for like 2,000 years to help achieve a state of calm and relax muscles. So, I mean, the problem is not that many kids want to do it. But for those kids who will do it, I think yoga is a really good thing to try. And by the way, meditation as well. There's a kind of meditation called mindfulness-based stress reduction. It's a meditation-based program which is not allied with any religious group or spirituality. It's simply based on reducing stress. And they've used this in a number of studies in schools and showed better behavior and better academic performance in the kids doing it. It's called mindfulness-based stress reduction, mindfulness-based meditation. And so that's another kind of mind-body thing that can be really helpful for kids with ADHD, especially, kind of older kids who can really get into it, and teenagers especially, if they're willing. And finally, along that area, martial arts.
Oh, yeah.
I really am a big proponent of martial arts for kids with ADHD. Not all of them, of course, but it teaches a lot of things that are important for ADHD: self-discipline, being in control of your body and muscles, respect, behavior. And given the right teacher, I think it can be really effective. I always remember this story this dad told me about how he sent his son to a week-long, sort of camp, a week-long martial arts camp. I can't remember what martial art it was. And Dad went to the little demonstration they had at the end of the week, just didn't think it was any big deal. And there's his child standing absolutely still for an hour, doing exactly what you're supposed to, the whole hour, The teacher said, "What did you do?" I mean, I've never been able to get my child to sit still for 10 minutes. Yeah, what did he do? I don't know, but there's something about that whole thing that can be really effective, given the right teacher. You want the Mr. Miyagi, not the bad guy from the Karate Kid,
Right. Yeah, we've heard such great stories about martial arts from parents, absolutely all the things you say, discipline, courtesy, focus, all of it, yeah. Question here from someone, something comes up often just in general with our parents of kids with ADHD. Her son is on Intuniv and is doing really well, helping in school, but at 4 o'clock when it's time for sports, everything wears off and it's a big crash. He has difficulty listening to coaches, following directions, and other people have written in about crashes also with other medications in older kids. Is there anything to give him at that hour that will help him focus and yet not affect his ability to fall asleep just a few hours later?
Yeah, see, that's the problem is that people, the sort of standard line is to give more short-acting Ritalin or something.
Right.
And that's, that can work, but of course that can really interfere with sleep, and that means they're probably not going to be hungry for dinner. It's funny that, I mean, I get this question a lot about about the stimulants like Adderall and Concerta and, that. But I hardly hear that about Intuniv, because Intuniv is supposed to be the once-a-day dosing, and it's supposed to last all day long, into the night. So mostly that's not a problem, but I guess in this case it is. One thing, Intuniv is just a long-acting form of guanfacine. So one thing to do is change to the guanfacine, which you can give 2 or 3 times a day. Now, that's sort of a medical approach. It's for when stimulants wear off, a lot of kids have rebound where they get really crazy hyperactive. And for that, I often use something called valerian, or a combination of valerian and other calming herbs. And that can be really helpful, just to calm. There's a product I like called Valerian Super Calm, made by Herbs for Kids, which can be really helpful, just sort of calm things down. It's really hard to find some herb or something that will improve focus. One of them is called pycnogenol, works for some kids, Pycnogenol. So you could try that given like an hour before things start to wear off. But that's a really difficult one. Calming the kids after the meds wear off is not too hard. Doing something to help them concentrate is harder.
It's tough, yeah. We have a number of questions about sleep problems for kids. Another time of the day issue, wondering about melatonin, which some people report doesn't really work, and wondering about light therapy or aromatherapy or other ways to help a child sleep.
Yeah.
ADHD child sleep.
So first thing about sleep is basically sleep hygiene. That means you want to get that last half hour to hour before bed, you want to let them calm so they can start making their own melatonin. That means if they're sitting there in front of the computer for the last hour, getting excited, getting all this light and flashing lights, they're not going to just sort of come into bed. So sleep hygiene is doing those things in the last half hour to hour before bed that will calm the child, get them away from the electronics, maybe reading, take a bath, all that kind of stuff, So that's number one. Number two, I find that melatonin is effective in 3/4 of the kids I give it to. Now, I know it's not effective in everybody, but that's the first thing I would go to if falling asleep is really the problem. Sometimes you have to play with the dose. The dose can be anywhere. Some kids, just 0.5 milligram or 1 milligram works, and some kids need up to 5 milligrams. So you might have to keep working on the dose.
Right. This person who wrote in, it's a 13-year-old son, and 3 milligrams of melatonin, she reports, really are not doing much. So that sounds like
they could still go up to 5.
Go up to 5, yeah.
But even so, it may not work. Another thing that can work is valerian root. Just like I said, for calming, valerian is well known for sleep, very safe, and you can give valerian. Another thing that can be helpful for general calming is called 5-HTP. That's a 5-hydroxytryptophan, which is metabolized into an amino acid that helps you fall asleep. So those are the few of the herbal things. The other thing is I was talking about if you can find a professional who teaches self-hypnosis, that can be really effective for sleep things.
Interesting, yeah.
Like when I have a kid who can't sleep, I teach them self-hypnosis and I make them an audio tape, and which they can play at home as they're going to sleep. And often that's very effective.
That's really interesting. My daughter, who has a lot of problems sleeping, ADHD, plays audio tapes a lot as a sleep aid.
Yeah.
So, really.
You can even buy some commercially.
Right. What about aromatherapy?
Yeah. So I don't use it much, but I think I think people report that some aromas, I can really like lavender, for instance, are very calming, and I certainly have no problem. They're very, very safe. You can look up on the web which ones tend to work and try them. You just want to make sure you don't swallow them or something like that. They're meant to be inhaled.
Here's a question from someone who has the impression that medication may be more helpful with inattentive aspect of ADD than it is for hyperactivity. and she's specifically wondering about other supplements or exercises that help with the hyperactivity specifically. Is that?
First of all, I disagree with that. I think
okay.
that medications, and the research shows us, are just as helpful for hyperactivity as inattention. That's number one. And second of all, most of the supplements and stuff I'm talking about are absolutely helpful for hyperactivity part as well. In fact, I really want to emphasize, and people think it's really hard, this elimination diet can be so helpful for hyperactivity. I had just had a
I'd love
child,
to hear more about how that works, how the elimination.
Yeah, so I just had a child. So an elimination diet means that you take away a food or a certain group of foods for some period of time, and you watch the reaction of the child. For me, I usually do 3 weeks, and I usually do what I call a multiple food elimination diet, where you eliminate gluten, dairy, corn, soy, and eggs at the same time. In which, parents hear that and they go, oh my God, what will he or she eat? But actually they can eat any meat, any vegetable, any fruit, any bean, rice, quinoa. So there's stuff to eat. Mm-hmm. So anyway, you do this for 3 weeks. And then if they have a very positive reaction, then you start adding the foods back one by one and see which food triggers it. Now, I'm not saying that all kids have a dramatic response to this, because they don't. But the ones who do, I had a mom come in the other day. She said, I cannot believe how well this worked. I am a skeptic. I never thought this was going to work. I just did it to make sure. And this is amazing. The child calmed down, started being less irritable, started being able to concentrate better, was doing his homework.
What was the trigger in that case? Was it?
They actually haven't started adding the foods back yet.
Oh, so they don't know yet. Wow.
They don't know yet. So this I saw them after they'd gone off the diet. But gluten, if you want to know the most common two, gluten and casein, gluten and dairy.
Right.
Those are by far the most common ones. And so if people aren't really up to, doing that whole elimination diet, you can simply do gluten or dairy, or better yet, gluten and dairy. One problem with doing only one is, what if the child is sensitive to 2 foods?
Right.
If they're sensitive to gluten and dairy and you only remove dairy, well, you may not see much because they're still sensitive to the gluten. There's a common analogy, like if you have 2 tacks in your foot and you take one of them out, it still hurts.
Right. Dr. Newmark, is there a place that you recommend on the web or in your book to find elimination diet spelled out? I think a lot of people.
Yeah, it's in my book. It's in my book. And now that you mention it, I can attach it to my website too, to my Facebook
to your
page.
slides. Okay, that'd be great. Yeah.
Yeah, so I'll do that. And it's a very safe diet for a few weeks. You really don't have to do anything special. There's nothing to be lost nutritionally by getting rid of gluten. And, the dairy, there's the calcium issue, protein. But for 3 weeks, it's not really that big a deal. And a lot of times people would use something like coconut milk or almond milk and just, almond nuts are off the diet too, but that has calcium. If not, you can use just a little simple chewable calcium supplement. But otherwise, as long as your child will eat some meat and some, just other stuff, it's really not a nutritional issue. You don't have to worry about nutrition for 3 weeks. And most kids don't like it, but they will continue to eat, just like we talked about before. Right,
they'll be hungry. So, here's a question. I think this person is referring to, without naming it, sensory integration therapy. She says, I've come into contact with parents and a reputable child psychologist who report positive results using a kind of physical therapy for ADHD involving techniques that use spinning exercises and other movements that cross the midline of the body. Can you comment on any research that supports this?
Okay, I can comment on the technique. I can tell you that there's no good research supporting it yet.
On sensory integration therapy?
Yeah, so sounds like sensory integration therapy.
Right.
And sensory integration therapy is a kind of therapy based on the fact that many children seem to have difficulty, like, dealing with the sensory input in their life. And the idea is if you can help them feel more calm in their body, that will feel more centered, and so they can integrate this input, sensory integration, that this will help their ADHD symptoms. And I've certainly talked to parents for who feel that this was helpful. So if I definitely think if you have a child that seems to have sensory issues, like
hating the feel of tags. That was one that we
right, hating the feel of tags or loud noises,
clothes, socks,
crowds,
gloves, right.
Right, and or else they can be the opposite. They can be
sensory,
where they're always whacking into people and touching and just sort of, that kind of thing. So I think it's very reasonable to give that kind of thing a try. That can get expensive too, unfortunately, but some insurances do pay for that. There's another technique that's a type of sensory technique called Handle, all capitals, HANDLE, which is a different kind of sensory integration therapy that I've also found that is effective in some kids with ADHD. So I think exploring those can be a good idea for some kids.
I think sensory integration therapy is done by occupational therapists. Is that right?
Occupational therapists or physical therapists?
Physical therapists, okay. I would say also that we do have an article on our website, in our search bar for sensory integration, that talks about sensory integration and how to distinguish kids with sensory issues from ADHD, where the symptoms overlap and where they're different. So that might be helpful to this person.
There's a lot of controversy about whether sensory processing disorder or sensory integration disorder deserves to be a separate diagnosis.
Really?
A separate syndrome. There's just an article in the main pediatric journal saying, no, it's really no proof it's a separate syndrome, but I don't really care. I know that a lot of kids with ADHD do have sensory issues, and so they need to be treated with whatever diagnostic box you want to use.
Yeah. Here's a person who's asking about chelation therapy. I'm not sure what that is.
Chelation. Chelation therapy is based on the idea that kids with ADHD have toxic amounts of heavy metals in their system, things like mercury or lead. I don't do chelation therapy. I don't really believe in it. It's way more used in the autism world than the ADHD world, because of the whole mercury issue. But there's certainly no research on chelation therapy for ADHD, and I'm not a supporter of it, though I wouldn't go so far as to say nobody would ever benefit.
Right. This is very curious of Dr. Newmark's opinion of the David Alert light therapy sound machine or any other feedback therapy like that, and how it might help children with ADHD.
Yeah. I saw that question because you printed it, put it on the web beforehand, and I'd never heard of it. So I went and looked it up because somebody answered, and it sounded very interesting. I don't think there's, the research doesn't really demonstrate that it works yet, but it's a way of kind of using various kind of light stuff to change brain waves, basically, neuronal firing of neurons in the brain. And, all I can say is it's possible that it works. I really look for some good research that proved it, and I didn't see any. It also, there's this whole set of stuff like there's also other kinds of therapies where they actually send signals to the brain in order to try and change brain firing. And all I can say is most of this has some theoretical justification, but there's not really a lot of research, and I'm not even sure that we know that it's safe.
Really? Yeah.
So I think it's really in the kind of preliminary research stages, and it may turn out to be a good thing, but
too soon to say.
It's for me to say anyway, especially in kids.
Here's a note from someone saying that the Harvard School of Public Health has just done a study of the milliamp range transcranial electrostim.
I looked that one up too, and I have to say I couldn't find. That's one of the other things that I was just mentioning. Milliamp transcranial electric therapy is when you give very tiny little electrical impulses to the brain, to the surface of the brain, which then causes a change in how the brain neurons fire under that part of the brain. So theoretically, let's say you could give it to the frontal lobe, and that would change brain nerve firing in the frontal lobe and possibly help it. So I saw some studies about it, and they're very, very preliminary. I didn't see that particular one from Harvard, but I put it in that same category as very, very early in the research.
Right. It sounds like not something maybe to jump onto, whatever it is. What do you think it is? Transcranial electrode.
Oh, no, I know what it is. What it is they attach little electrodes and they give very tiny electrical impulses to the scalp, which changes the firing of the brain neurons under that part of the scalp. So that's what it is. Transcranial, through the cranium, electrical stimulation. So that's how it works. I got clear about that. And they use it for a number of different things, and they say theoretically it could help ADHD. I just don't think the research is there. And I couldn't find that article. So if that person wants to send that in, I'd be really happy to see it.
Okay.
You could transfer it to me, and I'll be happy to give them my feedback.
Okay, send it to Susan at attitudemag.com if you're out there. A question about tyrosine.
Yes,
L-tyrosine.
Amino acid L-tyrosine, and I have never seen any research showing that that's particularly helpful for ADHD.
Okay.
So.
Might
be common.
Here's a question: caffeine and ginseng. Questions about those
caffeine
two?
And ginseng?
Yep.
Okay, so caffeine, I'm assuming you're not talking about those as one product, but...
No, sorry. Two separate items.
Yeah, so caffeine's really interesting. Caffeine is these stimulants, Ritalin and dexedrine and all those, are very similar in effect to caffeine. Caffeine's a stimulant as well, and as most of us know that, just like Ritalin, if you take caffeine for some period of time, most people can concentrate better and, focus. So it's not surprising that caffeine can be a little helpful for some people with ADHD. They used to do, way back before the ADHD meds were so popular, they did a couple of head-to-head studies of caffeine and ADHD and Ritalin products, and it looks like for most people, the caffeine has more sort of jangly side effects. But I distinctly remember one child in my practice, he was like a 16-year-old, and all the stimulant meds had horrible side effects for him. But he found if he nursed one of those monster drinks throughout the day, he could actually concentrate.
Wow. Yeah.
Yeah, so I think it's very reasonable that some people might find a little bit of caffeine to be helpful. The problem is there's so many side effects in some people, especially little kids. I mean, you don't, with caffeine, they don't sort of recommend it, but there are kids, especially teenagers, who might make use of it in some way. You just have to be careful because obviously a lot of people can't sleep after they take caffeine, despite the medications, or they get jangly, or they get a fast heartbeat, or whatever. But and then ginseng is that what you said, ginseng? Or
ginseng, yep.
Yeah. So ginseng is another one of those herbs that's generally good for overall function. Again, another adaptogen. There was one study that indicated it could be helpful for ADHD, but overall I haven't found it has dramatic positive effects. But it's a nice herb, and I have no problem with people using it.
Okay. Coming back to neurofeedback, which is one of the alternative therapies that has been shown to really be effective. There's some questions about, I guess there are some subcategories within it. So Geraldine's asking, which type of neurofeedback do you find most beneficial? Traditional, infralow, or lens? And I'm not sure what those mean, but I guess.
Right, yeah.
And then Loretta, another question about Loretta neurofeedback system.
Yeah. I have to say that I don't feel like most of the people I've gone to have done traditional.
Okay.
I've had some people who do lens neurofeedback, which seems like it was helpful, and I don't really have experience with those other two. There's a lot of things that have sort of developed out of from the traditional EEG neurofeedback mode.
Right.
I'm not enough of an expert to know which one works best. I think most of the studies were on traditional neurofeedback.
Okay.
Rather than the other ones. but it could be the other ones are more, can be just as helpful. I would advise going to somebody. There is a sort of certification body for neurofeedback. I would definitely advise, you can find that on the web.
Okay.
Going to somebody who's certified rather than just anybody who says they can do it.
Okay. That leads me to a question a number of people have asked. How do you recommend finding an integrative or complementary physician or is there
it's hard.
It's hard,
The one website is, if you can find somebody, the Arizona Center for Integrative Medicine, which is Dr. Andrew Weil's site, has trained hundreds of doctors, and you can go on that website, and if you can find they have a find a physician place, and if you can find somebody there, that would be great. Just you can just Google Arizona Center for Integrative Medicine.
There's no trade.
There's lots of great integrative doctors who didn't go through that program, and so that's just a question of use the web, use your friends. That's all I can say. It's hard.
Yeah.
Some of the major universities do have integrative medicine programs now. They have them in Philadelphia. They have them in Wisconsin. They have it here at UCSF. California, so that's one place to start too, I guess, is, some of the major medical centers do.
A set of questions from a number of folks who either their child themselves or their spouse is taking ADHD medications and really don't like the side effects, don't like the way they make them feel, and they're sort of wondering how should they go about transitioning from medication to alternative therapies.
Oh, that's a good question. I mean, it certainly depends on the individual case. I mean, almost all of the stimulants you can stop, right on the dot. I mean, you don't have to like taper them or anything. On the other hand, I mean, if you have a kid who's, say, was having tremendous difficulty in school and the stimulants make them do better, it's sort of unfair to just sort of stop the stimulants and have them have a horrible time at school the next day.
Right.
So, I mean, one great time to do it is over the summer, where the school demands aren't so high. And another thing to do is working with a doctor is to try and institute some of these alternative things, diet, supplements, iron, zinc, while they're still on the medications, and then kind of bring them off at a time that's
bring in the alternatives and then try.
Add, for instance, omega-3s and check their zinc and their iron level while they're still on the medicine.
Right. Okay. That's great. Well, I think we're out of time. This has been super helpful. I want to recommend to everyone again Dr. Newmark's book, ADHD Without Drugs. A recap of many of his work with children, natural care of children with ADHD. And thanks so much, Dr. Newmark. Very much appreciated.
Thank you. Bye-bye.
Bye, everyone.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.